Welcome to Cardio Radio, a podcast of the Ohio Cardiovascular and Diabetes Health Collaborative, also known as Cardio. This is Dr. Michael Constant from the Case Western Reserve University School of Medicine, and I serve as the principal investigator for Cardio, a statewide network of Ohio's 7 medical schools. Cardio is funded by the Ohio Department of Medicaid and shares best practices to improve cardiovascular health, diabetes outcomes, and to eliminate health disparities in Ohio's Medicaid population. The opinions and recommendations in this podcast are those of the presenters and not those of Cardio and its sponsors, and are not intended to be a substitute for medical advice. I hope you enjoy today's podcast.
Hello, I'm Dr. Orson, a professor emeritus at the University of Cincinnati and a member of Cardio's Team Best Practices. It is my distinct pleasure today to share a conversation with Dr. Mladen Golubic, a clinical professor at the University of Cincinnati and the medical director of the OSHA Center for Integrative Health. Dr. Golubic previously served as medical director of the Center for Lifestyle Medicine at the Cleveland Clinic prior to his current tenure at the University of Cincinnati. He has a research background across myriad areas of interest and has been a recipient of National Institutes of Health funding in the field of nutrition and cancer. We are ecstatic that he has agreed to share his expertise of the Mediterranean diet with us. Welcome, Dr. Golubic, as we'd like to call him, Dr. G.
Thank you, Dr. Austin. I would like to thank also Cardi-OH for this opportunity to speak with you today.
You're welcome. Dr. G, before we get into details, can you first briefly tell us what the Mediterranean diet is?
Although the focus of Mediterranean diet is on overall eating pattern rather than following strict formulas or calculations, there are 2 common features of Mediterranean diet that really require the discussion. The first one is that the eating pattern is predominantly plant-based, meaning that the foods of animal origin contribute only about 10 to 15% of daily calories. And then the second one is that most foods consumed are whole and minimally processed. One can describe Mediterranean diet as an eating pattern with lots of vegetables, fruits, and legumes such as beans, lentils, peas, chickpeas. It includes a recommendation for regularly eating grain products. And very important here, those should be whole rather than refined, like whole grain breads and whole grain pastas. It includes plenty of olive oil, nuts, and seeds as the main sources of healthy fats, while animal fats such as butter are limited. There is also moderate amount of animal fats from dairy, about 2 servings daily, poultry, about 2 servings daily, and eggs, 2 to 4 servings weekly. Fish and seafood, especially fish rich in omega-3 fatty acids, are eaten at least twice per week. And there is very little or no red meat, with poultry and fish being eaten instead of red meat. It also includes little or no sweets or sugary drinks, often using fruits as a dessert. A moderate amount of red wine is often consumed with meals. And I want to remind our listeners that on this topic of wine and alcohol in general, if you don't drink, don't start.
Thank you, Dr. G. I'd like to explore this a little bit further. What is the Mediterranean diet pyramid and how are the food groups structured? Can you also address why there is a recommendation for consumption of certain nutrients, whether daily or weekly, which is so important in this eating model?
The Mediterranean diet pyramid illustrates that diet is part of an overall lifestyle. Starting at the base, at the foundation of the pyramid, you will not find depictions of foods, but rather an emphasis on physical activity and social connections, including enjoying meals with others. Moving upward on the pyramid, you'll see the core foods that are recommended every day: whole grains, fruits, vegetables, beans, culinary herbs and spices, nuts and olive oil. Then fish and seafood are higher on the pyramid, typically eaten at least twice a week. Dairy foods, especially fermented dairy like yogurt and traditional cheese, are eaten frequently in moderate portions. Eggs and poultry are also part of the Mediterranean diet that can be consumed occasionally. And then red meat and sweets are rarely eaten and are located at the top of the pyramid, indicating the least frequent consumption. Water and wine, for those who drink alcohol, are typical beverages.
Thank you. For those of you who would like to see that visually, we can link the pyramid graphic in the show notes. Now that we know what makes up the Mediterranean diet, can you tell us about where it originated?
There are 22 countries surrounding the Mediterranean Sea, and each one has some unique features of their eating patterns. Yet there are some common characteristics of Mediterranean diet that allow us to have a good idea about what the study subjects were asked to eat when they participated in studies that were examining the benefits of the Mediterranean diet. That way, we can all compare the results from different studies using the same dietary intervention of Mediterranean diet, regardless of whether the study was done in Spain, Italy, United States, India, or China.
Okay, that's very helpful. I want to explore this a little bit more. Can you speak to the role that the Mediterranean diet may play in improving cardiovascular health?
Yes. Benefits of Mediterranean diet stem from consumption of foods that positively affect several key pathophysiological pathways that are involved in development and progression of cardiovascular disease. For example, the diet that favors foods high in fiber and rich in antioxidant and anti-inflammatory compounds is characteristic of Mediterranean diet. Lack of diverse types of dietary fiber is one of the most pervasive deficiencies in our modern typical American eating. In our typical American diet, more than half of daily calories that are consumed are derived from refined and processed foods that are low in dietary fiber. And because only unrefined plant foods contain dietary fiber, eating a Mediterranean diet rich in whole, unrefined plant foods ensures healthy and diverse gut microbiota that is associated with good cardiometabolic health. Plant foods, including diverse types of culinary herbs and spices that are widely used in Mediterranean cuisine, ensure the abundant supply of anti-inflammatory and antioxidant compounds believed to be important for the health of not only the endothelial lining of cardiovascular system, but also of other cells that provide defense against free radicals. We know that such free radicals are generated during cell metabolism, thus ensuring the optimal health of all tissues. Another feature is limited saturated fat intake. When one eats more nuts, seeds, and olive oil in cooking, along with reduction of consumption of red meat and butter, the intake of saturated fats is lower, and the intake of monounsaturated and polyunsaturated fats is higher. It is well established that dietary saturated fat is the key driver of elevated LDL cholesterol, and we know that chronically high blood levels of this bad, lousy, lethal cholesterol is one of the main causes of development and progression of atherosclerotic cardiovascular disease. And then another feature is that those who adhere with Mediterranean diet consume healthy, long-chain polyunsaturated omega-3 fatty acids. When we look in contrast to saturated fats, those unsaturated fats promote a healthy blood cholesterol profile and are anti-inflammatory when we compare them to omega-6 fatty acids. In addition to heart health benefits, long-chain omega-3 fats also support brain health.
It's good to know that the Mediterranean diet focuses on healthy fats and reduces saturated fat intake. What other aspects of the diet, Dr. G, can benefit heart health?
Well, I would say the first one, it limits sodium. Eating foods high in sodium can raise blood pressure in most people, thus increasing the risk of heart attack or stroke. Mediterranean diet is rich in foods such as vegetables, fruits, beans, nuts that are naturally low in sodium and high in potassium and magnesium. So in addition, there are other beneficial phytochemicals that are critical for the optimal regulation of blood pressure. It limits refined carbohydrates, including sugar. Refined grains and grain products such as white breads, white pastas, white rice, and similar high in refined carbs, and universally lead to increased blood sugar levels, increased inflammation, and increased oxidative stress. We know that they provide empty, with quotation mark, calories without other nutritional value and often have little or no fiber. In contrast, consumption of 100% whole grains and grain products such as breads and pastas have the opposite effect, in part because of mediated processes via gut microbiota.
Okay, thank you, Dr. G. What does the latest scientific evidence say about the Mediterranean diet's effect on heart disease, stroke, and mortality?
Yes, that's at the heart of this discussion. Scientific evidence about benefits of Mediterranean eating patterns on cardiovascular health stem from early epidemiologic studies by Professor Ansel Keys in 1950s to 60s. That was a 7-country study. And it ties to the present day via an impressive number of studies, including randomized controlled intervention studies that have been accumulated over time. Let me just summarize the findings of the 2 key studies. The first one is the Lyon Diet Heart Study, published in 1999. In this randomized controlled trial, the authors reported the benefits of the Mediterranean diet for secondary prevention of coronary artery disease. Patients in the experimental group were advised by the research cardiologist and dietitian during a 1-hour-long session to adopt a Mediterranean-type diet. And patients of the control group received no dietary advice from the investigators, but were advised to follow a prudent diet by their attending physicians. The study followed 605 patients with recent myocardial infarction for a mean of 46 months and found that a Mediterranean diet reduced the risk of cardiac death and non-fatal myocardial infarction by 70% compared to the control group. The second major study is the PREDIMED, randomized control study in the primary prevention setting that was originally published in 2013, then was retracted because of irregular randomization, and later was reanalyzed and republished in 2018. The authors demonstrated that the group randomized to Mediterranean diet showed a statistically significant reduction in the risk of major cardiovascular events, primarily stroke, when compared with reduced fat eating pattern. About 7,500 Spanish adults aged 55 to 80 years with at least 3 cardiovascular risk factors were randomly assigned to one of the 3 dietary groups. The first one was Mediterranean diet plus extra virgin olive oil. There was about 50 grams of olive oil consumed per day. The second group was Mediterranean diet plus mixed nuts. There were 30 grams of nuts per day. And then the control diet, where patients were instructed to consume low-fat, conventional, typical diet. So after 5 years, the Mediterranean diet plus extra virgin olive oil group had a 30% lower risk of the primary composite endpoint, cardiovascular death, myocardial infarction, or stroke, compared to the control group. The second group, the Mediterranean diet plus mixed nuts group, had a 25% lower risk. And both Mediterranean diet groups with olive oil and nuts also had significant reductions in blood pressure, cholesterol, and body weight compared to the control group.
Wow, those are fascinating studies. Have there been further studies conducted more recently?
Absolutely. Recently, randomized trials showed that the more whole rather than refined plant foods are consumed, the larger the positive effects on the pathophysiologic mechanisms driving cardiovascular disease development and progression. For example, in a randomized study of 22 pairs of identical healthy twins who were free of cardiovascular disease, twins who consumed fully plant-based diet, when compared with the twins eating healthy, whole foods, omnivorous, Mediterranean-like diet, had significantly decreased levels of fasting insulin and LDL cholesterol, and have also lost more body weight. Both groups of twins received unrefined whole foods. In another trial, patients with established coronary artery disease who were on guideline-directed medical therapy and were randomized to consume vegan diet had an impressive 32% reduction in high-sensitivity C-reactive protein when compared to patients eating a healthy omnivorous American Heart Association diet. That fits nicely into the Mediterranean eating pattern.
Thanks, Dr. G. I wanted to ask you to share your expertise on this next question. What specific components of the Mediterranean diet are thought to contribute to improved heart health?
No specific component of the Mediterranean diet has been shown to be as beneficial as the whole diet. It is the synergistic effect of fiber-rich, plant-based foods and replacing saturated fat intake with monounsaturated fats from olive oil and long-chain polyunsaturated omega-3 fatty acids from fish. As I mentioned earlier, higher intake of whole unrefined plant foods provides a broad spectrum of anti-inflammatory and antioxidant compounds that have been shown to be beneficial when it comes to maintaining the health of endothelial lining of cardiovascular system. In a more recent randomized crossover study, a low-fat vegan diet resulted in improvements in body weight, lipid concentrations, insulin sensitivity, both from baseline and when compared with Mediterranean diet group. While blood pressure decreased on both diets, it did more so on the Mediterranean diet, and that's probably because of polyphenols-rich olive oil that was present in Mediterranean arm.
Okay. How does the Mediterranean diet work differently from other heart-healthy approaches in managing cholesterol, inflammation, and blood pressure?
We know that people who adhere to the Mediterranean eating pattern tend to have healthier cholesterol profiles, lower blood pressures, and inflammation markers. So all key risk factors for developing atherosclerotic cardiovascular disease when we compare them with the usual eating approaches. I think it is the emphasis on health-promoting foods of plant origin that are usually whole, minimally processed, and reduced intake of foods that are known to increase blood pressure and inflammation and LDL cholesterol, such as foods rich in saturated fats, red and processed meats, and dietary fiber-deficient sweets and sugary drinks. As mentioned earlier, I would like to emphasize that while Mediterranean eating pattern is clearly superior to control diets used in most studies, several randomized studies show that fully plant-based eating pattern can further reduce inflammation markers such as high-sensitivity CRP, fasting insulin, LDL cholesterol, body weight when compared with matched healthy omnivorous diets, including Mediterranean diet. Based on my experience at Cleveland Clinic, when I worked with Dr. Caldwell Esselstyn in his heart disease reversal program, and as medical director of Dr. Dean Ornish's heart disease reversal program, one of the intensive cardiac rehab programs, I learned that proper guidance and continuous support of a team of lifestyle medicine experts is essential to ensure that patients would adhere closely with this type of diet. I'll say regretfully, in our society's food environment, where healthy options are not the default options, in restaurants and even in the hospitals, and with limited time devoted in our clinical practice to help patients change their eating behaviors, to me, it's not surprising that over time, many patients gradually started reverting back to their usual way of eating.
That's very interesting. What are the main differences in food philosophy and nutrient focus between the Mediterranean and DASH diets?
Well, while the Mediterranean diet evolved over millennia by people living around the Mediterranean Sea, the dietary approach to stop hypertension, known as DASH diet, originated from a research study funded by the National Heart, Lung, and Blood Institute and was officially brought into existence in 1997 after the publication of a clinical trial that showed that dietary changes alone could significantly lower blood pressure. The DASH diet does share many similarities to the Mediterranean diet. It focuses on nutrient-rich foods such as fruits, vegetables, whole grains, lean protein, and low-fat dairy while limiting sodium, saturated fat, and sugar. While Both diets are very similar. The main difference is that the DASH diet was specifically designed to limit sodium to a maximum of 2,300 milligrams per day, or even lower, 1,500 milligrams for a stricter version of DASH diet, while the Mediterranean diet does not have a specific sodium limit. The DASH diet also emphasizes higher intake of low-fat dairy foods, with a goal to provide more blood pressure improvement by increasing calcium, magnesium, and potassium, because low-fat dairy is a good source of these minerals. And here I would like to emphasize the fact that has been documented that 1 cup of kale has as much absorbable calcium as 1 cup of milk. And green leafy vegetables, especially of cruciferous brassica genus, such as turnip, collard greens, mustard greens, are excellent sources not only of calcium, but also the 2 other blood pressure lowering minerals, magnesium and potassium. In the Mediterranean diet, olive oil is the main source of dietary fat, while in the DASH diet, olive oil is simply the recommended type of fat. After controlling dietary sodium intake, the Mediterranean diet was found to be superior to DASH diet in office blood pressure levels, possibly due to the presence of polyphenols and other beneficial compounds. It's worth emphasizing that both diets reduce the prevalence of metabolic syndrome similarly. And there was another difference in that while moderate intake of wine is optional in Mediterranean diet, wine is typically not included in DASH eating patterns. So there are some appreciable differences.
Fascinating. Which diet has been shown to be more effective in lowering blood pressure, and which is better for cholesterol or overall cardiovascular risk?
The association between the adherence with both the Mediterranean and DASH diets and cardiovascular disease risk factors reduction is well documented. In regard to lowering blood pressure, the DASH diet has been more extensively studied than the Mediterranean diet. In a systematic review and meta-analysis, a total of 20 articles reporting for almost 2,000 participants were included in that meta-analysis. And the duration of intervention ranged from 2 to 24 weeks. The DASH diet was found to result in significant decreases in both systolic and diastolic blood pressure and in the concentrations of total and LDL cholesterol. And these changes predicted a reduction of approximately 13% in the 10-year Framingham risk score for cardiovascular disease. Other beneficial effects of these dietary patterns include positive effects on insulin resistance, blood glucose, and lipid profiles. The secondary analysis of a 3-month-long intensive dietary intervention among patients with hypertension that compared DASH and Mediterranean diets, both low in dietary salt intake, the DASH diet reduced hemoglobin A1C, while the Mediterranean diet also reduced fasting glucose, total, and LDL cholesterol. It was shown that high adherence to Mediterranean diet has been associated with higher HDL, lower total cholesterol, triglycerides, and LDL cholesterol levels in most studies. And in this particular study, the Mediterranean diet was slightly better at lowering systolic blood pressure than the DASH diet.
Okay, fascinating information. For those with specific cardiovascular risk factors, Dr. G, like, for example, hypertension, high cholesterol, how do you decide which diet might be the better fit?
Yeah, thank you for this really important practical question. To make such decisions, first of all, one must obtain not only the detailed dietary history of a patient, but also more broadly the general lifestyle history. For example, we need to know about the main reasons that drive a patient's current eating habits. We need to know their detailed work and family circumstances, and the patient's confidence with cooking, among other aspects of their self-care practices. It is recommended that healthcare providers prescribe the particular eating pattern changes that the patient can implement and sustain in a gradual and feasible manner. I want to emphasize it is critically important that any dietary prescription has to be developed in collaboration with that patient. Clearly, you cannot go wrong with recommending either of the two diets, Mediterranean or DASH diets. In addition, a fully plant-based diet may be beneficial to patients if done under supervision of an expert. If patients adhere to either the Mediterranean or DASH diets, they will eat healthier, and positive changes in cardiovascular health will likely occur. As with physical activity, the best eating pattern is the one that the patient can follow in a sustainable way. Interestingly, the American Diabetes Association added the Mediterranean diet as an evidence-based diet recommended for diabetes prevention in 2026, and it also listed elsewhere in the cardiovascular prevention section that a variety of evidence-based diets can be appropriate, including DASH and Mediterranean diet.
Thank you. As you know, Dr. G, fast food has taken over the entire world. When we think about the Mediterranean diet more specifically, from the time of Ansel Keys's 7 countries study report in 1978, how does that juxtapose with the diet that's consumed today in Mediterranean countries? Is that a correct statement? Is that something that is problematic or not?
Yeah, I'll be happy to show how problematic it is. Multiple studies are confirming a growing consumption of ultra-processed foods, often abbreviated as UPFs, across Mediterranean countries. While this ultra-processed food intake still remains much lower in these regions when compared to countries such as United States or United Kingdom, where 2/3 of calories come from these ultra-processed foods, that rise is nevertheless of increased public health concern. For example, in a prospective study from Italy, in which 23,000 men and women were followed for 15 years, they found that high adherence to a traditional Mediterranean diet combined with low ultra-processed foods consumption emerged as the optimal dietary pattern for reducing the risk of all-cause mortality by 24%, cardiovascular mortality by 20%, and non-cardiovascular, non-cancer mortality by 43%. So the conclusion from that is that dietary guidelines really should emphasize the importance of reducing ultra-processed foods consumption alongside following a Mediterranean eating pattern to really fully maximize its health benefits. A disturbing aspect that is happening is the rapid incorporation of ultra-processed foods into eating habits of young people in Mediterranean countries. For example, a recent study reported that children and adolescents living in 5 Mediterranean countries that participated in the so-called Delicious Project had a median unhealthy ultra-processed foods consumption of 1.8 servings per day, while 95% of children and adolescents consume daily unhealthy UPFs. The contribution of these ultra-processed foods to total energy intake has nearly doubled over the 15-year period in specific demographics. Not surprisingly, the consumption of unhealthy ultra-processed food was associated with an overall unhealthy lifestyle that, besides foods eaten, included changes of food beliefs and behaviors, eating practices, and also sleep and physical activity. And in addition to changes in these dietary patterns, there are other important trends that are not often captured in studies that could explain the health-producing effects of eating such a diet. This might include the diminished frequency of sharing meals with family and friends and greater tendency to eat on the run. As you know, I'm from Croatia, my wife is from Spain, and we have witnessed the changes in dietary patterns and emergence of fast food, as well as eating without the distractions of TV and other electronic devices. For example, the results of a study conducted in Dalmatia region of Croatia along the Adriatic Sea a few years ago showed that young, reproductively active generation, in spite of having a higher education and socioeconomic status, exhibited more adverse eating behaviors. with lower adherence to the Mediterranean diet and lifestyle in general than the older population from the same region.
Thank you. How can a patient realistically adopt the Mediterranean diet pyramid in a modern, fast-paced lifestyle?
The word is realistically, yes. In my consultations, I review both the Mediterranean and DASH eating patterns. I provide links to resources when appropriate and feasible. And I also discuss whole foods, plant-based eating pattern as per Dr. Esselstyn, Dr. Onish heart disease reversal programs. Specifically, I and our nurse practitioner focus on helping patients find ways to do the following. First, to include more green leafy vegetables into their diet. The second thing is to work on replacing refined grain products with 100% whole grain breads and pastas, to add more legumes to their eating and include fruits as a dessert into their eating pattern. We provide popular and easy recipes and provide links to culinary medicine videos at our center's website.
I'm happy to share those with our listeners in the show notes.
Wonderful. The very important part is that in our counseling of patients and the information we give them, we spend less time focusing on foods to minimize, such as ultra-processed foods, red meats, egg yolks, butter, and full-fat dairy. We clearly ask them to reduce those, but we emphasize the need to experiment, to focus on progress, not perfection, and steps to evaluate if the prescribed dietary lifestyle modifications are moving patients closer to their desired goals. And we discuss achieving better control of blood pressure, glucose, or lipid profile, and or body weight, reducing stress, and also improving their mood or better sleep. Now, knowing which foods to eat to support optimal health and to better control cardiovascular risk factors is necessary, but often insufficient to ensure positive changes in eating behaviors. I would like to stress that one needs to learn the key principles of culinary medicine to improve meal preparation skills by actively participating in hands-on learning about how to prepare simple but healthy meals and snacks and eat healthily on a budget, among other meal preparation skills. My suggestion for a budget-friendly meal is to focus on meal planning to avoid food waste, to buy in bulk, to start with dry beans, whole grains, cook from scratch, make secondary meals, use frozen fruits and veggies as cheaper, and also to minimize the food waste. It is also very important that medical professionals serve as role models for our patients, because food is not only powerful medicine for our patients, but it's essential for our own health. And I hope that our conversation will serve that dual purpose.
Dr. G, we can't begin to thank you for lending your time, energy, expertise, and guidance on this important area of medicine. I would also like to express our gratitude to the entire Cardio staff for helping us along this journey. And again, thank you. Your time and your information has been splendid.
Thank you very much. It was a great discussion. Thank you for having me.
Thank you. And a special thank you to you, our listeners, for tuning in to Cardio Radio.
This concludes today's podcast. Be sure to visit cardio.org to learn more about the Ohio Cardiovascular and Diabetes Health Collaborative.